Good morning.
Morning.
My name is Matt Valliere, and I'm the Executive Director of the Institute for Patients' Rights. For the benefit of some of my friends with disabilities, I'm an early 40s man of color with black wavy hair. I've got blue suit on, white button-down shirt, pink floral tie. Okay. We're gathered here today to face a threat to our lives, rights, and equal human dignity as people with disabilities. Assisted suicide laws. The system is broken, inequities in healthcare abound, and both for-profit and government insurers care more about their bottom line than they do about people. Throughout modern history to the present day, the lives of people with disabilities have been devalued in a society that sees our lives as less worth living, less worthy of scarce medical resources and healthcare dollars, better off dead. And as a little tip of the hat to Liz Carr, who may be watching from the UK and who produced with the BBC an amazing documentary after that name, Better Off Dead. Better off dead, we're not. We are individuals with disabilities and nonprofit organizations that work for disability and patient rights. As we find ourselves fighting for the basic care, long-term services and supports, durable medical equipment we need to live, states like New York and Illinois are passing assisted suicide laws that classify certain people for deprioritized care. Under assisted suicide laws, people with life-threatening disabilities, and only people with life-threatening disabilities who say they want to die can get a state-facilitated, medically assisted suicide. Everyone else gets suicide prevention and the usual protections afforded by the law and professional standards. If a medical professional hears a desire to harm or kill, they will initiate the standard of care, but not for people with life-threatening disabilities in legal states like here in New York. That's not choice, it's eugenics. In the backdrop of the UN, as many from around the world gather for the annual conference on the Treaty for the Rights of People with Disabilities, this group is proud to announce that we have filed 2 pivotal lawsuits in federal court to overturn the assisted suicide laws here in New York and in Illinois. Plaintiffs in these 2 lawsuits join in solidarity with similar lawsuits filed against the states of California, Colorado, and Delaware. Our collective goal is to end inherently discriminatory assisted suicide in the US for good. I have no doubt that this issue will be heard before the Supreme Court of the United States, where we hope for justice and the abolition of these heinous public policies. We have with us today our lawyer and several national and New York-based disability leaders to discuss the New York law, how it impacts the disability community, and the lawsuit. We'll take questions from the press at the end. If you have any, please come to the front and I'll hold the mic for you. We need you to state your name and the outlet from which you come. Thank you. First, we have Ian McIntosh. He's the Executive Director of Not Dead Yet, an organizational plaintiff in the New York lawsuit. Ian.
Thank you, Matt. Around the world, assisted suicide laws are first sold to the unsuspecting public as narrow, compassionate measures reserved only for those who are terminally ill and as but one more healthcare option to choose from. But that's a lie. As Diane Coleman, the founder of Not Dead Yet, once said, assisted suicide is not about relieving the suffering of the dying, it's about relieving the suffering of the living who don't want to care for them. American proponents who have championed the Oregon model, the same model Canada initially adopted that has pushed over 100,000 people into early graves, want to bring similar policies to America that masks social injustice as eligibility for assisted suicide. However, last year, the UN Committee on the Rights of Persons with Disabilities, in its concluding observations, criticized Canada's euthanasia program for violating the treaty and normalizing death as a response to inadequate supports. Precisely. Political will should fight for adequate supports and services to live our lives. Housing, healthcare, these are the areas where people with disabilities want choices and compassion. The stakes for disabled Americans have never been higher. The threat is real, but so is the resistance. We can do better. We are not dead yet. It's my privilege to introduce lead attorney for our New York lawsuit, Ted Kittila. Ted?
Good morning. I'm Ted Kittila, a lawyer with Halloran, Farkas, and Kittila. Our firm, together with Rosen, Bean, Galvin, and Grunfeld, are serving as counsel for the plaintiffs in the case that was filed this morning in the United States District Court for the Eastern District of New York, captioned Brooklyn Center for Independence of the Disabled versus Governor of the State of New York. Plaintiff Brooklyn Center for Independence of the Disabled is joined by 9 other plaintiffs: Mr. Jose Hernandez, Ms. Anita Cameron, Self-Initiated Living Options, Independent Living Center of Hudson Valley, Regional Center for Independent Living, United Spinal Association, Not Dead Yet, National Council on Independent Living, and the Institute for Patients' Rights. And the case number for the media is case number 26-3492. The lawsuit that we filed seeks to block the state of New York from moving forward with its planned implementation of its recently passed assisted suicide law, which is scheduled to go in effect on August 5th, and ultimately to overturn the law because it violates the Americans with Disabilities Act, the Rehabilitation Act of 1973, the Affordable Care Act, and the Equal Protection Clauses and Due Process Clauses of the U.S. and New York state constitutions. For too long, the lie has been spread that assisted suicide is an act of mercy for people whose lives are supposedly, quote, not worth living. For my clients and the thousands of people in the state of New York living with life-threatening disabilities, people who face discrimination every day, assisted suicide represents an existential threat. Again and again, we have heard stories of medical providers embracing ableist definitions of quality of life in their counseling of people of disabilities. Again and again, we have heard the lie told that assisted suicide represents the, quote, best alternative, quote, for a life with challenges. We've also heard stories of doctors advising patients with, quote, medical certainty that they have only months to live, only to then have those same patients live for decades longer. We have also heard stories that assisted suicide is a painless, peaceful process, only to discover that it is anything but. We are here today to face those lies head on, to shine a light on the harm that will result if the law is allowed to go forward. Persons with disabilities will bear the brunt if this discriminatory law is allowed to take hold in the state of New York. For those who say it is simply an option that is being made available, for many living with disabilities, it is discrimination, plain and simple. The system automatically labels persons with life-threatening disabilities as terminal, allowing them to be steered towards suicide help rather than suicide prevention. Ultimately, a system that offers assisted suicide to a class of people who are automatically labeled terminal is a system that is on the verge of breaking. Today, with the filing of this litigation, we are working to stave off that danger. We look forward to continuing the fight. Thank you.
Thanks so much, Ted. We appreciate you. And you're representing this group along with Mike Bean, his firm, and Rosen, Bean, Galvin, and Grunfeld. Sharon, are you okay to scoot over here to make your remarks? Everyone could back up a bit.
contigo y municipio. Con la fecha de San Diego.
Thank you, ma'am. It's so cold. It's so cold. Medical Aid and Dying Act passed by the New York State Legislature and signed by Governor Hochul paves the way toward an efficient way to relieve public and private health care providers of the responsibility to compassionately care for the most vulnerable. Doctors can now give the green light for patients who they deem likely to die within 6 months due to a medical condition to kill themselves. As government health insurers driven by cost savings, increased barriers to effective treatments, pain management, and support services with assisted suicide on the books. Death may feel like the only option for some people. As a disabled person, I know very well how people are devalued once they are sick or disabled. Despite the many strides the disability community has made to integrate into society, I sense an increasing devaluation of the lives of people with disabilities. In fact, when Governor Hochul passed assisted suicide into law, she was getting prepared to cut essential health care services for hundreds of thousands of New Yorkers. Also, she is making it much more difficult for many personal care users to access personal care that they need in order to live. Remember, once someone who is diagnosed with a life-threatening illness, he is considered disabled by law. They do not require external signs of disability to be considered disabled. So by saying that someone diagnosed with a life-threatening illness is likely to die within 6 months, I qualify for physician authorized death. Kathy Hochul and the New York State Legislature effectively discriminated against people with disabilities. Today, we are filing this lawsuit to send a message. We will fight systemic devaluation of disabled lives.
Thank you so much, Sharon. That was Sharon Shapiro from the Brooklyn Center for Independent Living. Now we have Denise Figueroa from the Hudson Valley Center for Independent Living. Also an organizational plaintiff in the lawsuit. You might need to sue the city too over the sidewalk.
Good morning, everyone. Good morning. My name is Denise Figueroa. I'm the director of the Independent Living Center of the Hudson Valley in upstate New York. I am a person who has grown up with my disability. As an infant, I acquired polio. I contracted polio, and I've grown up living the life of a person with a disability who understands that my life is never valued the same way as other people's. I have experienced discrimination all of my life, whether it's people looking at you in a certain way. People's expectations are definitely different than for a non-disabled person. The medical profession is probably one of the most discriminatory places that anybody with a person with a disability can experience. Doctors don't see us as valued, or as they see us as failures. Their failure, that they were not able to cure us, because doctors are there to get people better, to get them well. They don't see a person with a disability as not being sick. They look at us and see us as someone who's sick. We as a director of an independent living center, we see people every single day who are fighting the medical system, fighting for care, fighting for access. It's the most inaccessible system. And so when we are relying on doctors to make the decision about whether or not our life is worth living, we can pretty much guarantee that they're going to look at us and think it's not worth living. Our center every day also tries to help people get out of nursing homes and live in the community, to live independently. We rely on support services like personal assistance services. Those services are being cut. They've been cut for the last couple of years with a whole revamping of the system. But in addition to that, even eligibility is being cut now. And so we are really concerned that this legislation is going to make it possible for people with disabilities to not have services, but be offered assisted suicide as their option instead. We've seen it happen in other states. We know that it can happen in other countries, that it already happens in other countries. And our center is very concerned that our consumers are going to be discriminated against in this process. The Americans with Disabilities Act that was passed in 1990 supports the rights of people with disabilities to live independently in the community with the support services they need and in the most integrated setting possible. This threatens the Americans with Disabilities Act. It violates the ADA. We think that people with disabilities will be discriminated against with this legislation. Thank you.
Thank you so much, Denise. Powerful. Next we have Jose Hernandez. He is one of the individual plaintiffs in the lawsuit and a member of United Spinal Association and organizational plaintiff in the lawsuit. Jose.
Hey, Jose.
That's good. Can you hear me?
Good. Hello, everyone. My name is Jose Hernandez, and I am the Advocacy and Policy Associate for the New York Association on Independent Living. I am also a member of United Spinal Association, which represents 5.5 million people with living with spinal cord injuries across the country. I'm here today to oppose the assisted suicide law that was passed in New York this year. As someone who has lived with a disability for the last 30 years, it is painfully clear that assisted suicide laws will make it much easier for someone with a disability to be offered lethal drugs to end their lives rather than the more expensive treatment to extend it. As I have aged with a disability, I have noticed that my health is not what it used to be in my 20s. After a recent doctor's visit, I am worried that I may be experiencing some changes in kidney functions. If I were to become seriously ill, I would qualify for assisted suicide if the treatment I need was out of my financial reach. I fear that, as has happened in Oregon and in California, the treatment I need will be denied, while assisted suicide would remain the cheap and accessible option. Society should not be afraid of getting sick, old, or disabled. This has been the natural course of action for centuries. This country once cared about preserving and extending life, much like my mother's. She was diagnosed with stage 4 ovarian cancer when she was 28 and I was only 8 years old. She was given 6 months to live. At the time, assisted suicide was not available, and thankfully so. Doctors did everything they could, and her insurance paid for the life-saving treatment she needed, and my mother survived 13 years. If she had chosen to end her life, I would have missed out on the opportunity of 13 years of goodnight kisses, home-cooked meals, and the opportunity to be raised by a mother who made me the strong man I am today. New York should not be taking the position of allowing doctors and insurance companies to dictate which treatment constitutes life and which constitutes death. Many doctors make mistakes. As you can see, my mother lived 13 years despite a 6-month diagnosis. We need to stop this law because it is dangerous and discriminatory. We deserve and we demand better. It's time for the courts to take action to create this egregious law. Thank you.
And next we have Anita Cameron. Anita is a longtime disability advocate. She is one of the individual plaintiffs in the lawsuit and an adept organizer. Anita.
Good morning, can you hear me?
Good morning, Anita.
Okay. Sounds a little low. Maybe I'll try to use my outside. Good morning, everyone.
Good morning.
My name is Anita Cameron, and I've been a disability justice activist and community organizer for 44 years. I worked with ADAPT, with Not Dead Yet, and many other organizations. And I've been a member of the Regional Center for Independent Living for 20 years. So over the years, my health has deteriorated. My last health event, it landed me in a nursing facility. And after I got out, I applied for home health services, but was denied due to the new regulations. They changed the requirements. I would later lose my Medicaid, which is the only insurance I had. And now, assisted suicide has been passed here in New York, and I'm terrified. And I'm terrified because I no longer have access to the medications that I need and the health care that I need. And my chronic conditions have now turned terminal, which makes me eligible for assisted suicide. And it's frightening, it's really frightening that in a dark moment, I can request to die, and I will be helped to do so. Assisted suicide, it's harmful. Disabled people in New York are being denied home care services or having their services severely reduced. The disabled people who rely on Medicaid are losing their insurance. The state's consumer-directed personal assistance program has been gutted to restructuring, reducing over 700 fiscal intermediaries in the program to only one, and the results have been catastrophic. Add to this, personal care attendants are not making a living wage, or they can't get paid, not only because of the restructuring, but typically attendants, they don't really get paid much. And added to this, the current and proposed overtime laws and requirements that seriously harm both the personal care attendants and the people that they're working for. So making assisted suicide, legal here in New York has now made it easier to kill rather than care for those of us who already live with discrimination and injustice. Because when faced with loss of access to services and support, some of us may feel that we have no other choice but to die. And this is why we must end assisted suicide here in New York and everywhere. Thank you.
Yay! Anita.
I just want to thank everyone once again for coming. I don't know if we have anyone with any questions that might like to address any of the speakers. Okay. Seeing none, that concludes the formal remarks. Please feel free to stay in solidarity. Thanks to everyone for coming.